Hello everyone, good morning, and I hope you all are doing good. I'm Shan Devedi, and today I'm going to conduct a seminar about decentralized health records powered by AI. I'm choosing this topic because I've worked on a product which is solving this real world issue that has been faced by a lot of us. Like, we have to go again and again to register the same healthcare issue. Let us say that you had done a test 2 years before, but it is nowhere to be found, and even the doctors don't have any registry of it. So, how to solve it? So, one way that companies are emerging and solving this issue is by making a decentralized health record system, which will be powered by AI. The word AI here is not just to hype things up and to build an excitement, but it also solves a real world issue. Is when you have a collection of a lot of good healthcare records, you can make it useful by making analytics and making sure that there is some preventive care that is being done by these AI. So yeah, I hope my screen is visible right now. So, yeah, introduction to this healthcare innovation, exploring AI and blockchain. Basically, this is the integration of AI and blockchain where these technologies are helping to elevate healthcare. It offers a transformative potential. Basically, when a patient uploads his healthcare documents and medical records, it is being verified by an healthcare organization and it becomes an inventory for them and for the patient as well. There is results being uploaded, there has been tests and prescriptions, medicines uploaded, which gives a good data for the AI and the real world doctors and health organizations to work on. The current problem here is that we have fragmented data. Most of the medical records are on paper and not digital. So data is often scattered across various providers. Let us say one organization made a prescription for you and the other one gave you some test results. So they are not connected, whereas they are connected for you and your healthcare. So it becomes difficult for healthcare professionals and patients to access these data points. Data breaches, as these data are stored centralized, if virtually, and or on paper or hard copy format, these are easily breached. Basically, what if you forgot the data? What if you went to a medical record center or a medical test care center 3 years ago and the data was cleaned by their system? So it's nowhere to be found, but it is a critical piece of information for you and your healthcare. What are decentralized health records? This is the um, basis of our innovation and idea that I'm letting you know about. Its key features and benefits are: it leverages the distributed networks, whether it be a chemist or it be a healthcare center where you're getting your medical tests, or it be a doctor or an hospital. We are connecting all these distributed networks and blockchain technology to enhance patient control, security, and data integrity, to making it more transparent and tamper-proof. As the medical record is being accessible by both the healthcare organization, the hospital, and the doctor, it makes a uh, great input for them and will help a lot in the analysis. And the analysis would obviously help all the patients in terms of preventive care and also risk alerts and medicine reminders, etc. Patient ownership. All of us know that when a test result or a medical record is handed over to us, the actual ownership does not belong to us, but it belongs to that healthcare organization. But when we talk about Web3, when we talk about decentralized data, it empowers and the to the patients, and the patients have authority to control who accesses their health records. They can grant or revoke access to their data at any time. This gives them flexibility of what data points should be shared to whom, and if they want to avoid sharing it to a specific healthcare organization or any person, it is up to them, giving them total ownership and consent, which is not even thought of in the current system. Which, let us say that we get a medical healthcare record in a particular healthcare organization, we do not have the control over who will access it or who will not. The whole organization may have access to it, and it can or cannot use it with a negative intent too. We may never know. Sharing it temporarily. Maybe we want some analytics on a specific medical record. But after it's done, we think of maybe we'll stop sharing it so that it is not accessible to anyone. So that feature will also be available, making sure that the control is totally in the patient's hand. The role of artificial intelligence. AI plays a vital role in healthcare, and when tied with decentralized healthcare, it will make sure that we have a disease risk prediction, which will definitely prevent a lot of mishaps that the biggest healthcare organizations can have, enabling early diagnostics, and which will make sure that uh, diseases will be diagnosed at stage 1, because when we have multiple healthcare data points to work on, it will definitely improve our predictability, prediction and diagnostics. Ultimately, it will foster a more effective and proactive healthcare system, which we want to happen as soon as possible. Why are we combining AI and decentralization? First of all, for security and integrity. We know that the purpose of decentralization or Web3 industry as a whole is when you give power not to an organization or a person in particular, but to everyone that is involved. So the blockchain technology will ensure that all the patient information is integrated and encrypted in a way that the power is with the patient itself. The model will allow for real-time updates, promoting actual trust on all the stakeholders, whether it be patient, hospitals, doctors, medical organizations, etc. And talking about the AI part, AI enhances the decision-making capabilities, and as I've been talking about, an accurate prediction and personalized treatments. Even it will give us reminders on medicine, reminders on any physical activity, or give us alerts if anything wrong has been done by us, making sure that we live a healthier and better life with the help of AI and Web3. Real world applications. There would be three major real world applications here. One would be global digital records. Basically, global access to patient data, leading to improved collaboration among healthcare providers and enhanced patient care. AI early warning. AI driven systems analyze health data in real time, identifying potential health risks and enable proactive care. Secure data sharing. This is very important. We want the data that is being stored completely secure, and we want it to be transparent. That is why Web3 is called a trustless system. Basically, you don't have to trust it because it is the way it's built. It cannot be breached. It is completely secure. There would be obviously some challenges and limitations here. Blockchain scalability. As we know that blockchain might or might not be adapted by everyone. Let us say a town in tier 3 city or tier 3 area of India might not have all the technological access, leave alone blockchain and AI. So their adaptability to it will be lesser. But we have to push campaigns so that ultimately we can reach out to more audience who actually needs it and who actually requires it, proactive measures, and this healthcare system, which will actually prevent a lot of diseases and mishaps, will mostly be beneficial to those who need it the most and who would be in tier 3 and tier 2 cities where healthcare access is already less. So to make sure, we have to build a system that they know that something is bad may happen before it actually happens, because there may be delays in the physical part of it, but we can use technology, AI, and decentralization to make sure that everything goes by smoothly. So, yeah. And to sum it all up, I would say that we are embracing a new era in healthcare. We are making sure that uh, our predictive analytics of these medical records becomes better than ever. We are going to use multiple health medical record points, multiple medical record points, whether it be prescription, whether it be your daily routine, whether it be a test result, or maybe data from your phone, data from your smartwatch, making sure that what physical activities you're doing or not doing. This will create a lot of data points for us to work on and create create analytics, and there are many companies that are working on it. One of the real reasons that I am presenting this today is because I have worked on a project that aims to be there, and we are somewhere about to build this. It's called Ulalo. You can visit ulalo.xyz for more information, and we have built something like this. I am a product designer, and I have worked on the entire design and the thought process and how we should make it engaging for the user, so that he or she can definitely go daily and check their records and what the AI analytics is talking to them, and definitely upload some records and also give them rewards in the beginning so that it becomes engaging for them. Ulalu basically can give what no doctor, supplement, or app could ever give. So it is one initiative that I've been working on, and it is great with the team. And our initiative is to basically revolutionize the whole medical record and health tech system. So that was it. It was me, Ishan Devidi, talking about decentralized health tech using AI. And so, yeah, that was my topic for the seminar. And thank you and have a nice day.